Hello, everyone, and welcome to another edition of Founder Friday. I'm Sally Frank, the Global Lead for Health and Life Sciences, and we are sitting down today with Chetan Parikh, who is the CEO and founder of RAAPID AI. And we're going to talk about how they're helping healthcare organizations make risk adjustment more accurate and audit ready. And he's got an incredible team and an incredible organization. And so let's just dive right in. Chetan, for any of our listeners who may not be familiar with RAAPID AI, tell us what problem you are solving and more importantly, perhaps what inspired you.
Oh, first of all, Sally, it's always a pleasure and honor to talk to you. So thank you very much for inviting me to the Founders Friday. I think the key problem that I see in healthcare today is multiple. One is the three most important pillars of healthcare, which is the payer, the provider, and the patient. Where with all the technology and all the advances we have in medical field, still all three parties are very unhappy. The payers feel that they are not getting enough data to insure appropriately. The providers feel that they are not working at the top of their license. They are not able to pay attention to the patients. And the patients continuously feel, I'm not getting the love, tender loving care from my providers. And when I saw that, I realized that at the core of all of this is proper documentation and proper coding. And with the current technology and my experience in this field and the incredible team I had, we wanted to solve this problem with a big, hairy, audacious goal to make all three parties super happy. So that is the reason I got into this. On the other side, I feel that in any scenario that I have worked with, there are three main trilemma, I call it, where you can choose two, not all three. Either you get high quality, or you get a high speed, or you get at a high you want high quality, high speed at a low cost. And every time it's choose two, not all three. I think with the current technology trends, we can get all three. And so I'm super excited to be in this field that we are solving a very critical problem of the three most important pillars and the trilemma that is kind of a holy grail.
Yeah, that's tremendous because, yeah, when you're working in a system where no one is happy, it really can short circuit kind of what you're trying to accomplish. So, you and I both been in this industry for a long time. Healthcare organizations deal with a tremendous amount of unstructured data, unstructured clinical data. And when we think about unstructured versus structured data, the structured data is usually organized in a way that you can do the ICD-10 codes and all of that very easily. But tell us about some of the unique kind of challenges that you're working with when you think about trying to include unstructured data in that process.
Very, very good question. I think at the core of our our any system, and including healthcare, is we think terms of narratives. We usually have stories about everything, and these are captured either audio or text. They are seldom copied in databases or created in databases and tables, which has got very well defined boundaries and very well defined meta tags. And to understand this, what is explained or narrated in a human understandable, human graspable manner, so that the computer can understand it and process it, and then find meaning out of it, requires advanced technologies. So my first foray into this was using natural language processing, which really was state of the art until last year. Because what I mean by that is, NLP was fantastic. It used to understand, it still understands, the nuances of language as well as the subject. So if you're in healthcare, it understands how the language is conveying a complex subject or a disease or its progression or its procedure. However, within a note that is developed by a provider, there are elements which are structured. You'll see a table, you'll see a form, which might be a check mark or a fill up or multiple choice. or a table which has got merged columns and rows, and it becomes very difficult for NLP to decipher all of that. And in my experience, about 40% of pages which are in the narration have got these kind of structured data within unstructured. And so the new advanced technologies, what we call is document AI, is able to parse all of this with very high degree of fidelity. Now add to it already the available structured data which is in the EHR. You really augment all this information to make decisions. And Sally, you would be surprised, but 80% of information in healthcare, particularly patient related, is still unstructured. So only through advanced technologies, we are able to now understand and infer what is inside this amazing information, which talks about the patient, their conditions, the intervention of the provider, and how the patient's health is progressing.
So, yeah, it sounds like the way you've gone has really opened the door to applying unstructured data in new ways. So, tell us a little bit more about like the insights and the ROIs that your customers are achieving using your software and platform.
Very nice. In this day and age, uh, everybody is moving from cost to value. That, and so ROI is in the center. It's like the 800-pound gorilla in the room. You want to spend money, but you want to make sure it is spent in the right manner. You are getting the results. And healthcare, which was kind of immune so far, or at least it was not looking at ROI, is now coming into with the consumerism in healthcare as well. However, when we look at ROI in healthcare, there are multiple ways to look at it. And the lenses from which different people look at it are different. So let's say from a very tangible, a CFO's perspective is, if I'm spending $1, what am I getting in return? Our typical ROI is about 10x, which
Nice.
is like in a month and a half, you'll recoup what you invested for 1 year. That is the direct ROI because of the productivity gains that we are able to show to our customers. However, there are two other bigger levers. What I believe is at the core of every medical coding, Sally, what is important is the coding is very appropriate to what was documented, and the documentation should capture the all and the correct conditions of the patient and what the provider is doing to take care of those conditions. So if you have that, then you capture all the codes from it. Now there are two imperatives. One is financial imperative. You don't want to leave money on the table. You want to make sure whatever you have done, you get paid for it.
Mhm.
And on the flip side, you don't want to overbill, overcode, because
Right.
that opens doors to detailed penalties, scrutinies, and compliance issues. And now with CMS tightening the bolts, OIG and DOJ are also jumping in. So I think the ROI that our customers today look for is, can you give me, my money's worth with productivity gains, but at the same time, please ensure I don't leave money on the table. I get paid for every service I've provided, and make sure that everything that you do is defensible. We don't want to be in the crosshair of OIG or DOJ. So that is how we produce ROI and talk with the CFO, with the compliance officer, with the medical officer that, hey, we are going to make sure that if your documentation is accurate, we capture it. If not, we can also nudge you in the right direction through clinical documentation improvement tools.
Yeah, so finding that right balance between not undercoding and not overcoding so that you get exactly what you expect and what is equitable, frankly. Um, so as you think about, there's whenever you have a new customer, there's the part where you're showing them the technology and they're kind of buying into that vision. But as an early stage company, how is it that you also build trust? How do you earn that trust with those enterprises to encourage them to not only do business and do perhaps a quick pilot, but something where they're ready to invest long term for a production implementation?
Very, very good question, Sally. And that's really deep. Trust, I don't think, is now a luxury that only can be owned by by the experienced and larger companies, even those are being questioned because AI is too new. And trust is built by proving that whatever you are surfacing, you can defend it. I just gave a talk at Rise National, which was very well received because typically AI and all quantitative and maybe up to a certain degree qualitative evaluations rely on a term known as accuracy, how accurate you are. And accuracy, you can see, is related to trust. The higher the accuracy, the more they are going to trust you. But what we are finding, there is so much of subjectivity in medical coding that the same chart given to three different coders, they will code it differently. Coder one, we did an experiment, Sally, where coder one was about 10 years of experience, coder two was 11 years, and coder three was 8 years. And we gave each of the coders 10 different charts, the same charts. And we said, go code it. Each coder, we gave them ample time. The coder one came back and said, here are the codes. We said, are you sure? Oh, I'm very accurate. I know this industry. I've been in this industry. Coder two, the same. I'm very accurate. Yes, I'm perfect. Coder three, the same, confidence. When we took this and did what is known as the inter-operator agreement rate or inter-coder agreement rate, they were hovering between 70 to 80%. What it means is, how do you know what is the gold standard? And now if you don't have it, how do you trust it? So the best way to do it is to explain any code that we surface so that we can defend it against the guidelines that have been set up by CMS, the guidelines that have been set up by the customer, as well as the code books, the ICD-10 books, that if we can defend it, we don't need the subjectivity or we can minimize subjectivity. And that is how we build trust. And we tell our customers that the best way to do it is let us do a POC, a proof of concept or a pilot, and then give it to your coders. There will be differences, but let us now sit down and say, can we defend the codes? And if we can, then you should start trusting us. But again, we don't force it. It takes time because when the coders start looking at it, they still want to open up and say, they coded this. Is it accurate? Yes, it is accurate. But after a while, it's like, when we get a new credit card, we are going to look at the bill every month. But after 6 months, we are like, okay, it's a waste of my time. We hope that we are accurate enough so that the coders have the trust and we can defend all the codes we surface. But very, very important question of building trust, only through explainable AI, only through a glass box and not a black box AI.
Yeah, so very important for, as you said, organizations of all shapes and sizes to build trust with their stakeholders. So we've talked a lot about kind of what RAAPID does today and kind of the origins of your mission. What's in the future? What do you think the long-term vision is for RAAPID?
I think I'm very, very focused on one area because in my eyes, Sally, the entire healthcare ecosystem, including what we are doing, including, Microsoft Healthcare, everything originates when a physician and a patient meet. Right? It all starts at that point. And whatever they discuss get captured in a clinical note. And this clinical note, so that you can ensure that the patient gets the best care, any next steps or care progression or decision support system or billing, coding, any referrals, everything depends on this notes. And to make sure that it is uniform, that is why we have the ICD codes, right? So that you have a common language and your colloquial or the local lingo does not get misinterpreted. So anywhere where there is documentation involved, which gets converted to medical code, RAAPID wants to be the de facto, the household name in that space. That is my mission. Because if we are accurate in it, if we are defensible in it, if we are consistent in it, all the waste, abuse issues that we are facing today, the worries that the physician is not being able to pay attention to the patient, the patient worries that I'm not getting enough care, and the insurance company not having enough information to do their actuarial work for proper premiums, all of that can be resolved. So I'm very excited that through what we have developed, what is known as neurosymbolic AI, we are hitting numbers on defensibility and accuracy, which are north of 92% now.
Wow. And of course, that builds trust.
Yes, yes, absolutely, Sally.
So this segment is called Founders Friday or Founder Friday, and we want to make sure that we answer some questions that founders typically ask us about our program and the companies in it. So I'm going to ask you the biggest value Microsoft has brought to our startup during the time in program is?
I think the just just having that we are on Azure gives a lot of confidence to our customers that their data is secure because we deploy our solutions within the customer's Azure infrastructure. Second thing that I believe is the scale at which Microsoft operates. I believe north of 70% of healthcare has something or the other to do on Azure. So you can really reach out and you can talk a common language with the CIO, the CTO of these large organizations. So I think that partnership has been just invaluable. It brings, for us, for a vendor, it is easy to go on any cloud today, or even be on-prem. But that confidence that the customers have that you are on the right cloud, you can scale, their data is secure. I think there is no other cloud that is even close to Microsoft Azure.
Well, thank you for that. And so put yourself in a founder's shoes that has not quite selected their cloud partner. If you were to say, if you're a founder choosing a partner, my advice is, how would you finish that sentence?
Look for a partner who is not just going to transact in credits.
Mm.
Every cloud will try to attract you, and we have been through the same, through
Yes.
hundreds of thousands of dollars of credits. Look for the longer term partnership, the ecosystem that they have, the tools that they have, the reach that they have, the support that they can give. I think that is credits, are very short term. Means, in this race of, let's say, a marathon, credits are only the first 100 feet or 100 yards. So look for a partner who really can help you, augment you, position you, and your customers will also feel that, yes, you are doing something right.
Yeah, so it's less about what can you do for me today and more about a strategic alignment that allows you to grow and scale long term.
Absolutely, absolutely. And every founder, again, I have no idea about, or no doubt about it, that every founder is smart. They are going to look at long term. But sometimes the carrots that are placed in front of a founder early on are too attractive because all new founders are bootstrapping, or they haven't raised the capital yet. And
Right.
so they are like, hey, $100,000 is $100,000, but look beyond it. So
And if people want to learn more about Rapid AI, your website is?
www.rapidinc, it is RAAPIDINC.com.
Great. And if you're not part of the Microsoft for Startups program, you can check things out at startups.microsoft.com and follow Microsoft for Startups on LinkedIn as well. Thank you, Chetan, for being with us today and being part of our Founder Friday series. It's been great talking with you, and I look forward to the next amount of time that we have to work together in our program.
It has been a true honor, and thank you so much for the entire support that Microsoft and Azure has provided to Rapid.
Thanks.
Take care.